Genetics, does it play a role in detecting autism?
Seeing that if you've had an autistic family member, then the risk of having autism in subsequent generations is definitely higher. So genetics does play a role.
Are ADHD and autism the same?
No, definitely not ADHD, but they are both independent illnesses and independent disorders.
And is autism fully curable? Hello friends, in today's episode we are going to talk about a very important topic, ADHD autism, with Dr. Sugandha Gupta, who is a founder, director and chief psychiatrist at Delhi Mind Clinic, Karol Bagh, New Delhi. She has over 17 years of experience in the field of mental health. She is a proud winner of Dr. Ravi Pandey Young Memorial Psychiatrist Award. Not only this, Dr. Gupta is an avid speaker and has been invited to participate as a panelist on national news like Aaj Tak, NDTV, and other radio channels as well. Let's get started with Dr. Sugandha Gupta. Hello, Dr. Gupta. So today we are going to talk about autism. So we would like to start with the basics as always. What is autism?
Autism, before I describe what autism is, I would like to explain the term neurodiversity. So we all know what diversity means, right? We're all different from one another, even if we come from the same culture, same country, same family, even we're all diverse in our mannerisms, in our communication styles, in our emotional expressions. So this is a disorder, which is a neurodevelopmental disorder. It means that it stays with us as it grows older, and it has a wide spectrum of symptom presentation. Very wide spectrum. On one hand are cases which find it extremely difficult to function in the normal society in the normal way. And on the other hand are individuals who have such subtle signs of autism that they're not diagnosed throughout their life. Okay. So now to understand it more easily, let us briefly talk about a few of these symptoms, right? So autism is a disorder wherein children and later on adults also find difficulties with emotional expression regulation, communication, in their methods of play, in their methods of conversation, and many other things. So recently I had a parent couple. I think first the mother came with her child daughter who was in, I think, 6th standard or something. And she brought forth that the girl had been playing with children who were older than her. She would usually not play with dolls or something, but she would pick up utensils from the kitchen and either she would bang them very loudly, or she would put them down on the floor in a line, or she would take a plate or a bowl and would keep it, fingers round throughout. So she was always, also she wouldn't respond to her name many a time. Sometimes she would, but many a times she wouldn't. The mother also found it difficult to communicate with her. So if the mother wanted to ask her, what would you like to eat, or are you hungry, the daughter would speak very few words, very little meaningful communication, but mostly use gestures to communicate. And in fact, she had a late language development, speech development. The mother told me that when the daughter was very young, 2-3 years old, when she was hungry or she was thirsty, she would just pull the mother's clothes, take her to the kitchen, hold the mother's hand and point the mother's hand towards the water tap.
Okay.
So that is how she would communicate her needs. And because the speech was delayed, the school started late, then COVID happened, the girl was confined in her house to herself because everybody was busy in their other routines and everything. And then later on, when she was put into a school, there were a lot of difficulties. She wouldn't talk to the other kids, she would be in her own cell, she wouldn't follow the teacher's instructions, she wouldn't complete her work, she would forget things. She even had frequent altercations with the children in the van. So with all these things, the mother told to her father that something wrong. Our daughter's grown older. She's now almost 9 years old or something. And it's not like, she's behaving normally. The father ignored it. He said, no, she was at home in the COVID. Let it be. It's nothing wrong. Why are you unnecessarily worrying and all? And another 2 years passed by. But eventually, when the girls started finding more academic difficulties and teachers were bringing forth frequent complaints to the mother, that is when the mother came to us. So on examining the patient and sitting in the room with her, what we found was that the child was not able to maintain eye contact. So even though she knew
Okay.
that she was there to talk to the doctor, she was staring at her feet or looking here and there, even though she was attentive. She was
Mm-hmm.
aware of what was going around her, but she was not maintaining eye contact.
Okay.
Meaningful conversation was very little. She couldn't, pronounce simple words. Academically, she was very far behind. And then all the other relevant history was taken from the mother, wherein a diagnosis of autism was further evaluated, considered, and then the father was also involved. And once the information was given to them and formal assessment was done and it was explained to them, many other symptoms were revealed. So one of the common symptoms, like I said, is the play. So the play
Mm-hmm.
of these children is not like a normal play. So children like to play with the guns or bikes or dolls
Mm-hmm.
or paint or something, but these children don't like toys. Even if they
Mm-hmm.
play with toys, they wouldn't play with the car like a car. So they wouldn't, drive a car on the
Okay.
road or on the table. They would just focus on one part of the car. So only the tire will keep rolling it round and round and round and round and round
Mm-hmm.
for long time.
Mm-hmm.
So the play is very different. They are unable to maintain eye contact. The speech
Mm-hmm.
is generally delayed, but it's not that they cannot speak. It's just that they do not know how, what, when to speak. They
Mm-hmm.
find it difficult to pick up the cues from another person's behaviors, facial expressions, so they don't know how to judge another person's emotions and
Mm-hmm.
then accordingly respond to it. Certain repetitive stereotypical behaviors are there. For example, they would, keep going round and round in circles that stimulates them or keeps them calm. Clapping, uh, clapping their hands, fingers, looking strangely at their hands and fingers for a long
Mm-hmm.
time. So certain kind of weird behaviors are there. Weird as in that's how people, parents, friends or
Mm-hmm.
siblings describe to us. They're also very rigid in their behavior patterns,
Mm-hmm.
very selective in the food they eat, very selective in the clothes they wear,
Mm-hmm.
very selective in the routines they follow, otherwise they get
Follow.
very
Okay.
agitated. So
Mm-hmm.
this young girl I was talking to about was also very selective. She had great difficulty in eating solid food. Her
Mm-hmm.
mother had to, blend the solid food into a pulp and then she would sip it
Feed
through a
her. Yeah.
thick straw. She was not
Mm-hmm.
able to swallow, and all the examinations had revealed no difficulty with her digestive system per se. So if they like wearing a particular uniform, they like wearing that uniform only. If it's
Mm-hmm.
cotton. Then be it winters, if wool is not appreciated, they will not wear wool, whatever comes.
Right.
So, so these are a couple of symptoms that are brought forward by the parents or that are observed at a young age in children of autism.
Okay.
Their severity varies. There are some
Mm-hmm.
who are able to cope up in a regular school with some difficulties, and there are some who can have absolutely no meaningful conversation or maintain their own care, self care, diet, hygiene, and they have to be given a lot of support by their parents.
Mm-hmm. And like in the previous session, we talked about ADHD. So are ADHD and autism the same?
No, definitely not. ADHD and autism are definitely not the same,
Mm-hmm.
although they may be occurring together sometimes, but they are both
Mm-hmm.
independent illnesses and independent disorders.
Disorders. Okay. And is autism like fully curable?
Now, autism, unfortunately, is a neurodevelopmental disorder, meaning there is no cure for it.
Okay.
There are treatments available that can
Mm-hmm.
help control some of these symptoms.
Mm-hmm.
Symptoms such as, agitation,
Mm-hmm.
behavioral irregularities, to
Mm-hmm.
maintain their sleep cycle and all and other things. But there is no miracle cure. And unfortunately, there are so many myths and there are so many misinformations on the internet about a miracle cure
Mm-hmm.
of this particular diet, of this particular rock salt, or avoiding this diet, this particular protein item, and
Mm-hmm.
things like that. However, there is no cure per se for autism.
And those in false information on the internet is doing more harm than good, right?
Absolutely.
Mm.
And we frequently advise our parents also to be on the lookout for such things, that when they get
Mhm.
such an advertisement or
Mhm.
message, if they find that the thing is very expensive or it is experimental, they should certainly
Mhm.
discuss it with the doctor before taking up into it.
Right. Is there any medication for autism?
Again, unfortunately, there's no medication for autism per se.
Mhm.
However, other medications can be used to reduce the difficulties in communication, aggression, uncooperative behavior, agitation, etc. But there are no medications per se to reduce these symptoms. What rather helps patients of autism are different therapies. Occupational therapy, social skills training therapy, behavior therapy, desensitization therapy. So such children may be very, very prone to loud sounds. Okay, so that agitates them, they cannot tolerate. So in those cases, gradual desensitization therapy, etc., can help them make more comfortable in their surroundings. So different therapies depending upon what the prominent symptoms in one particular child are, and involving their parents into it can help curb down the symptoms to some extent, but it is definitely not going to alleviate completely autism in the child.
Okay. And like genetics, does it play a role in detecting autism?
Yes, genetics has a role, not just in detecting, but rather it's been seen that if you've had an autistic family member, then the risk of having autism in subsequent generations is definitely higher. So genetics does play a role.
Okay. And is like autism, we know that it's common in kids. So are we having autism in adults too?
Yeah. So autism is fairly unfortunately common in adults, but the thing is that if autism is not severe enough to be picked up in the childhood, that means that they are on that end of the spectrum where the symptoms are milder and that they do not cause a lot of dysfunction, right? So adults who come to us with a doubt of autism, because autism is not an easy diagnosis, especially when you do not have typically severe symptoms, correct? That is when a diagnosis becomes very difficult. So the adults who come to us come with 2 or 3 primary difficulties. One, in maintaining the relationship. They say that we find it difficult to understand what the other person is trying to say, what he or she is feeling. I do not know whether I laugh when they laugh. I do not know whether I keep quiet. So I'm mostly quiet and I'm withdrawn. I'm sitting there, but I cannot participate. I do not know how to express my emotions. So one is social communication, emotional reciprocation. So this is one difficulty they face. Other difficulties that they face is again with their rigid patterns and routines, that difficulty with noises or difficulty not being able to wear a particular kind of clothes, difficulty in not being able to eat certain chewy textured foods. So those are certain things. So these are also some things that if they're milder are generally ignored. The family accommodates, parents accommodate कि चलो ये नहीं खाएगा ये बना देते हैं. If he doesn't like this, he can always have that. Why do bother? So, and the adult also, as he grows older, learns to accommodate. So the symptoms are very subtle and they have to be prodded in deep to be picked up. But adults can present with autism, but generally with therapy, they can manage well.
Okay. And like in your clinic, if there is a patient with autism, how do you approach for the treatment?
So look, in children, like I said, for ADHD also, the diagnosis is a comprehensive clinical assessment first of all. So observing the child, his play, his communication, his language, his grasp over emotional cues, social cues, so on is observed in different scenarios. A detailed history is taken by his parents, his primary caregivers. If he's been a school-going child, we take the history from there as well. Then there are certain psychometric assessments, questionnaires, which enlist all the symptoms of autism in various presentations, various forms of presentation. So that list is discussed with the parents and the teachers to help us identify what symptom profile is present, to what degree that symptom particularly causes dysfunction, and on the basis of that, we reach a diagnosis.
Okay. And I have certain statements that I have collected through research. So I would like to know with you whether it's a myth or a fact. So all autistic people, they have the same symptoms.
Okay, absolutely not. That is completely not so true. It is a spectrum. It's a whole wide, big spectrum. Like this, nothing is completely black or white. There are shades of gray in between, and gray has innumerable shades. Similarly, autism also, innumerable symptom presentations. No two patients or children with autism would appear to be the same, even if you made to 10 children are made to sit together, or adults with autism are made to sit together, they would not be the same. Although the clusters are same, the parameters are the same, but they present differently in different children. So no two children would ever be the same.
Same. And autism is caused by vaccinations, like vaccines.
This is the biggest myth, and this is the most dangerous myth.
Mm-hmm.
Years of researches have been held, many awareness programs have been held, many celebrities have come forth and said
Mm-hmm.
so. Vaccines do not cause autism.
Mm-hmm.
Autism has always been there. It is certain dietary changes, it is
Mm-hmm.
certain lifestyle changes, certain genetic changes. Pregnancies at later ages, which is increasing now, is a risk factor.
Mm-hmm.
Mothers being exposed to certain toxic medications or drugs while they're pregnant is a risk factor. So there are certain definite risk factors which have been identified, and vaccines are most definitively not a single one of those parameters.
Okay. And okay.
Yeah.
And people with autism, they don't have emotions.
People with autism definitely have emotions,
Mm-hmm.
right? Unfortunately, they do not know how to express them,
Mm-hmm.
how to convey them. They
Mm-hmm.
feel hurt, they feel sad, they feel angry, but they don't know what's the correct way to feel what emotions, how to feel anger, how to feel sadness, how
Mm-hmm.
to feel hurt. And because they don't know how to feel or how to define, they do not know how to express. But
Express,
they're not
right.
emotionless.
Mm-hmm. And autism can be cured or outgrown. I think you tell that it cannot
Yeah,
be
we've
cured.
discussed this. It cannot be. Unfortunately, it's a lifelong disorder,
Mm-hmm.
and we can make it better in certain ways that is
Mm-hmm.
effort and consistency with treatment programs, but one cannot
Mm-hmm.
outgrow autism.
Okay. And autism people don't want friends or relationship.
People with autism certainly have difficulty in maintaining or sustaining
Relationship,
good
yeah.
friendship,
Mm-hmm.
relationships.
Mm-hmm.
And so it is difficult to say that they don't want it, but if they are surrounded, for example, there's a couple parents of
Mm-hmm.
an autistic child. The mother is providing a lot of care and attention and is empathic. This is the father who's easily agitated and is impatient by the child's
Mm-hmm.
behavior. The child will show emotions towards his mother, right? He will
Mm-hmm.
be more attached, he will express
Right.
carefulness, he will express
Mm-hmm.
love through other means. He may not go and say, Mama, I love you, or, but there are times when he would find the mother is sick or lying down, he may simply go and pat her
Mm-hmm.
uncomfortably or in a
Mm-hmm.
different manner to convey his emotions. But
Mm-hmm.
they have all emotions like us. They would like to stay close to people, but people are not acceptant of their diversity. They
Mm-hmm.
feel threatened. They do not know how to cope with it. And these people are the ones who push such children away,
Mm-hmm.
whether children or adults. So
Mm-hmm.
that is why then to protect themselves, to keep themselves safe, they maintain a safe distance.
Mm-hmm.
That is how I would probably like to put it across.
Of course. Okay. Only boys have autism.
No, that's again not true. Both the genders
Mhm.
are equally predisposed.
Equally.
Both the genders have equal presentation of symptoms also.
Mhm. And teaching kids with autism is difficult.
Yes, the parameters for teaching are very different. Unfortunately, the
Right.
education system the world over today is programmed to teach everybody the same way, the same thing, even if it serves no purpose. So, if you were to look at it, to fit every child into that would be difficult. But for that matter, this is not relevant only for children with ADHD or autism. Even
Mhm.
for normal children, one child is good with math, one child is not good with math. Yes, so teaching that child math does not always mean that because you have to work hard or he gets it's difficult. So he's abnormal or he should be diagnosed with something.
Mhm.
So there are definitely difficulties, but for them, teaching would mean not what teaching means for everybody else. For them, learning would be learning to communicate effectively, learning to pick up social cues effectively, learning to care for self effectively, learning to communicate their needs, their distress effectively,
Mhm.
learning to enjoy their surroundings presently. So, for them, the definition of teaching and learning would be different from what we usually define it as.
Mhm. So, like, you will like to give some message to teachers, like how they can help the kids with autism. I think it will be really helpful.
I would certainly like to say that no two children are alike, no two individuals are
Mhm.
alike.
Mhm.
Similarly, children with autism are different. They
Mhm.
are not weird, they're not crazy, they're not bad.
Mhm.
So, what they need is a little understanding, a little patience, a little empathy. However, when it comes to autism, attendance to the regular school may vary with respect to severity of these symptoms, right? But if there are some children with milder symptoms of ADHD, including them in the normal, so said normal or regular classroom patterns will help improve their symptoms rather than make it more difficult for them. So with some training, some patience, some guidance, certainly we can include them and help them live a full life or a nearly full life.
Right. And as a parent or a relative, if I know that this child is having autism, so how can I help that child?
There's a lot of training and psychoeducation that needs to be taken into consideration. How to communicate with a child who does not understand the words in the same manner that I do. It can be very frustrating for a parent to call out their child's name 5 times, 6 times, the child doesn't respond. Yeah, and there is a spoon that drops in the kitchen and the child immediately looks up attentively. So it is very demanding to be the caregiver for a child who is suffering from autism. But with relevant training, behavior therapy, things can certainly be better, but it is an uphill battle. One need to understand this. Please do not fall in for miracle cures. Stay connected with your doctors, your psychologist, your counselor, your occupational therapist, your speech therapist, whatever is advised, and look into it as something that will gradually get better. But the definition of better will also be different for each and every child and parent.
Thank you, Dr. Gupta. You have given such a nice content about autism. I think it will be very helpful to the viewers or the parents or the teachers, and they can take a help from this podcast. Thank you so much.
Thank you so much, Shilpa. It was nice to be here and certainly an important topic to be covered in today's time. I hope most of our viewers learn a lot from this. Thank you once again for having me on the show.
Friends, if you like any content in my video, please like, share, and subscribe to my channel. And also, if you want to contact Dr. Sugandha Gupta, all the links are provided in the description box. Thank you and have a nice day.